My name is Stephanie. Today we're going to be talking about acclimatization and high altitude. So today's agenda is jam-packed, and we have three incredible humans here with us today that are absolute experts in their field, which includes kind of what happens at high altitude and how we acclimatize in those environments. So we're going to go through some fast facts to start, why we acclimatize, how it impacts our body. Of course, we're going to talk about sicknesses, altitude sicknesses, HAPE, HACE, things like that. And then we're going to dive into some more science, the physiology of it. And then we're going to talk about what you can do before your climbs, during your climbs to acclimatize, some tools and resources, anything from Hypoxico tents to Diamox. And then we'll talk about some expeditions at CTSS that kind of use these strategies, and then how you can stay in touch with all of us here that are in the webinar. So I mentioned we have three experts in the house today. I am going to go ahead and let Dr. Brent do a quick introduction, because Dr. Brent wears a lot of hats at CTSS. He just quite literally got off an expedition with our team, but he is also a rural doctor in Australia in the Snowy Mountains. He services an incredibly large area of land and space out in Australia. So he's a doctor. He's a guide. He's also our go-to expedition doctor. If somebody else is on expedition and they have an issue or a question, we are calling Dr. Brent to get his advice as well. So what kickstarted your interest in taking your medical profession to the big mountains, Dr. Brent?
Thanks, Stephanie. Yeah, look, I'm based out here in Australia, working at the Perisher and Thredbo ski resorts day to day. I've just got back from an ice climbing trip with CTSS. You can see some of the ice in the image there behind me. So believe it or not, we can climb ice in Australia. So this was a huge surprise for our clients on this expedition, that they got to go ice climbing in addition to working on some key mountaineering skills. I've always been in the mountains growing up in Australia. I spent my childhood climbing hills with my parents, and that took the usual approach to then wanting to climb higher and further afield. And so one thing led to another, and I eventually ended up working up at Everest ER as the doctor looking after all the mountaineers and Sherpa up on Everest back in 2018. I also had a season with the Himalayan Rescue Association at their Ferrochet clinic at 4,500 meters, where we look more after their trekkers as opposed to climbers. And they're actually two distinct subpopulation groups of people that go to altitude, which we can touch on later.
Awesome. So I love that, Dr. Brent. Just like many of us, instilled from a childhood, the love for the outdoors, kind of combining a career with a passion, I think is just quite incredible. That's what I think many of us that are on this webinar have combined, our career and our passions together. So next up, we are going to go with Chad. Chad, you're next down on the list. So you've been at Hypoxico Altitude Training Systems for, I think I saw 3 years. But I know you've been studying the effects on altitude and humans for quite a long time. Tell us a little bit about your background, your career. We were just talking about passions and how kind of all of that has shaped what you do today.
Thanks, Stephanie. I spent a career in the Marine Corps as an officer. And so that was really started my interest in physiology and human performance, because obviously that was an important part of my profession. When I left the Marines, I had the opportunity to do an undergraduate program at Syracuse University and study the effects of high altitude on human performance in Nepal. And that sort of led the way for me to get a job at Hypoxico and continue to pursue my passion of, not only traveling to high altitude environments and racing and performing, but also helping others prepare for their expeditions or their adventures at high altitude. And, I'd like to think that my experience and my interests allow me to help others pursue their interests and goals. And that's where I'm at. And yeah, more on the practitioner side, but really excited to be here and contribute.
Awesome. Chad, like I mentioned, works with Hypoxico, and he actually works hand in hand with our next co-host that we have here today, Nick. Nick is at the Altitude Center in London, and we're also super thrilled to have you on board and here today. You've been a performance specialist, a physiologist with the Altitude Center for a little while now. Can you tell us a little bit about your background and how you support mountain athletes? Because I know that is your day-to-day of what you're doing out there, Nick.
Yes, I'm a physiologist, and thank you, Stephanie. I've been working in the space of high altitude for 6 or 7 years now. And yeah, my main role is getting athletes all around the world ready to head to the mountains, whether that be kind of physical conditioning people need to climb, or kind of alongside Chad, kind of looking at the altitude side of things as well. I specialize in what's known as environmental extremes. So I work on everything from hot and cold to altitude, and even do bits and pieces in zero gravity and some in the world of space systems. But I've specialized in recent years more looking at kind of 6, 7, 8,000 meter mountains and kind of the new trend in mountaineering of climbing very, very quickly. And yeah, the Altitude Centre, as you said, we've got our main HQ in London. So there was a couple of names actually I saw pop up on the participants that I reckon I've spoken to already. It's nice to have a chat again, I guess. And yeah, my main role here is the physiology side of things.
Perfect. So folks, a really round, nice group of folks here, kind of hitting all sorts of different passions, interests, skills, and expertise. All right, so let's dive into some fast facts. Our goal with this slide is just to really give you some baseline information so we could all start on the same page and with the same just baseline knowledge. Chad, I'm going to have you just give us a quick introduction. What does it actually mean to acclimatize? When we say that word, oh, I'm going to go acclimatize, what's my acclimatization schedule? What does that word help us understand? Give us a definition of that.
Basically, it just means a gradual adjustment to a new environment. And so in terms of altitude, it's just your gradual adjustment to a reduced oxygen environment. We'll talk a little bit more later about some of the specific strategies, but the way I would like people to think about it, and I know there's a lot of people here that are experienced in altitude environments, but there may be some folks that are not, that are new to it. I think about it kind of like training for a longer distance race. So if you're starting from zero and you're training for something like a marathon, you would build up gradually to do that. And along the way, you would have some points where you would actually step back a little bit, where you would have a week or a time period where you would do a little bit less. And this is kind of similar to the concept of climb high, sleep low. So it's really just about a gradual approach to becoming used to existing and performing in a reduced oxygen environment with a number of different strategies, approaches that allow you to get there and be at your best, considering that it's a very different environment and there are a lot of different considerations when you're dealing with a significantly reduced amount of oxygen, depending on the extreme of the altitude environment that you're getting into.
So folks, the word that I keep hearing him say is gradual. Getting a helicopter to the summit of Everest would not be a gradual acclimatization. In fact, that would be extremely scary and hard for your body if you were helicoptered and dropped at the summit. So that is the one word that I really keep hearing resounding. It's taking your time and it's adjusting over time to that change in environment. What I want to do now is turn this over to Dr. Brent, because we have a pretty cool chart here. And what I see happening on this chart, it's talking about atmospheric pressure. I mean, oxygen is in there, but atmospheric pressure seems to have a pretty big part of this. So can you explain this chart that we have up here? How does this work? What's actually happening in our atmosphere to make us feel a little bit different when we go up higher?
Yeah, certainly. So this chart sort of sums it up beautifully in that what we see is as we get further away from sea level, the pressures drop. People get a little bit confused on this and they think that there is less oxygen, less absolute oxygen available as we climb. But the percentage of oxygen in the air stays the same. It's still 21%, but there is just less air available, which means there is less of all of the gases available the further we get away from sea level. So here where I am, or where this photo in my background is taken at just above 2,000 meters of sea level, you can see that pressures are already beginning to drop. And so that people will start to feel short of breath. They'll start to have to work harder, and they'll really start to notice the effect that we have as the pressures start to drop.
So I want to talk about what happens. You just said there's a trigger, your body starts to respond. We're going to go into quite a bit more detail about what's physiologically happening in your body. But Dr. Brenton, give us a little snapshot. We have a couple of bullet points here. What is going on in your body once it realizes, uh-oh, there's less oxygen coming into my body?
So we're basically, the availability of oxygen drops as we climb higher. And various processes in the body are therefore stimulated to try and basically meet homeostasis so that we're able to continue to pump blood around our body, get oxygen to our brain and to our cells. So as we do acclimatize, our kidneys start to work harder so that what it's trying to do is balance out the acids in our body.
Okay, I'm going to go ahead and pass the next slide off to Nick, because Nick gave us some really, really great classifications of altitude. But I'm going to let Nick talk about where does actual high elevation, kind of high altitude start? How do they kind of deem, yes, your body is going to start to feel it right around here. And how do these different elevations kind of look and interact with each other? So Nick, I'm going to go ahead and pass this to you because you helped prepare this.
I think the first thing, and the reason that I put this slide together, is when you go climbing for the first time, the idea of altitude or the idea of the unknown is actually really scary. But for a lot of people, it's not something that you need to consider it, but it's not something that needs to be kind of the absolute forethought of your brain. You can see there on the left-hand side, altitude is typically split into 4 different kind of brackets. You get low altitude, which is from 0 to 1,250 meters, or for those outside of the UK, about 4,000 feet. Below that height, you will start to see an impact, but it's only going to be very minor. And the risk of altitude sickness in particular, which I know is what a lot of people who are here are concerned about, is relatively non-existent. It's very, very, very uncommon for people to suffer at these heights. And if they do, there's normally a reason for it. So there's a condition beforehand, or there's an additional reason that's led to it. After you move through low altitude, and you can see there, so I've tried to give a couple of examples so people can kind of relate it to somewhere that they might have been, or somewhere that they might be wanting to go to. So once you move through low altitude, you go to that moderate altitude, so 1,250 meters up to about 3,000 meters, 4,000 to 10,000 feet. This is the typical sort of height where most people start to feel the impacts of the altitude. And more from a physical perspective, you start to see a degradation in physical performance. Again, at these heights, some people do begin to suffer, particularly towards that 3,000 meter sort of mark, but it is unlikely. But this is where the real physical degradation starts to come in. So the fatiguing elements start to build and things like that. And for anybody who might know somebody who's an athlete, or anyone who's lucky enough to be an athlete in the past, this is the prime sort of height where athletes, and we're obviously in the middle of the Paris Olympics at the moment, will look to do their altitude camps. So this is around the physical performance zone. Once you lose to moderate altitude, you obviously get to high altitude and severe. This is where the risk of altitude sickness can start to rise. High altitude is quite a large bracket by definition. It's 3,000 to 6,000 meters. So that can take you all the way from kind of Machu Picchu at the low end, 3,800 meters, up to Kilimanjaro at 5,800 at the high end. And this is where, for the majority of people, they will start to feel the impact of the altitude. It's really important to say, like, not everybody is going to suffer, and not everybody is going to have really, really negative experiences at altitude. But within this height, it's very, very likely that people will at least start to feel the altitude. And that can range from kind of breathlessness or sleep disturbance or something really minor at the low end, through to some of the more serious things that Dr. Brenton's going to talk about later. And then over 6,000 meters is what's classed as severe altitude. And again, that can range from Denali at the low end of that, which seems strange to say Denali's low, but you get what I mean from that, all the way up to some of the big 8,000ers. And I think the other really important thing to say is, as you move through those four brackets, is that altitude itself has an exponential impact. As Dr. Brenton spoke about on the last slide, it's all to do with that partial pressure. And the further you go from normal, so the further you go from homeostasis, the bigger the impact is. So the way that I like it to break it down to people is, going from like 3,000 to 4,000 isn't necessarily the same as going from 4 to 5, which isn't the same as 5 to 6. There is an exponential impact. So the higher you go, the harder it becomes. A lot of that is due to the issues of the altitude causes, but also the higher you go up these mountains. So the key example, somebody who's climbed Kili, who's then off to Aconcagua, for example, there are additional challenges that the mountain's going to bring, such as cold and other factors as well. But I just wanted to pop that on there for everybody, just to show that if you're heading to kind of those 2,000-3,000 meter sort of ranges, altitude is something you need to think about, but it isn't necessarily kind of a massive, massive worry unless there's a real reason for it. But as you move through those heights, it does kind of break it down and kind of gives people a bit of an understanding of the type of challenge that maybe they've got in their head.
Nick and Dr. Brent, this is going to be a slide that I know you guys are going to talk on. This recaps a lot of what Dr. Brent was just talking about kind of in our introduction slide, what's happening physically in your body. So I want to give you one more chance to give a little overview of what's actually happening in your body, especially medically speaking. But then also I'm going to let Nick talk a little bit from his perspective on the physiological side as well.
So look, our body is really good at trying to adapt to any changes in our environment, but it takes its time. And so this is where we talk about the gradual need to acclimatize. It's the same when we go to a hot environment or any environment that our body is not used to and not acclimatized to. Our body will make slight adaptations so that we're able to survive and thrive in that new environment. So when we talk specifically about acclimatization, what we will feel is that we start to breathe a little bit faster and a little bit deeper. We'll note that our heart rate rises, and for most of us going to altitude are usually quite fit in the first place. You'll find that your heart rate will just be that little bit quicker than what it normally is. You'll find that for various reasons that you'll be peeing more. Some of it is to do with the fact that that's part of our kidneys adapting to the different pressures. It's also quite often because at altitude, it's in a cold environment. So we also tend to decrease some of our blood volume by urinating as well. And this is all backed up by various different homeostasis methods. It's basically our body adapting as we acclimatize.
Nick, would you like to add anything else, just kind of from your perspective of physiologically what's happening in the body?
Yeah, very, very similar to what Dr. Brenton said. And it's just the mechanisms that drive it. I know we want to keep everything high level and things like that, but I know with CTSS, I know the way that you guys run your trips is the big driver that causes particularly a lot of those adaptations or those changes you see on the screen regarding heart rate is all due to blood saturation. It's all due to SpO2. So if anyone who's climbed before, they might pop those little sensors on your fingers, or people might remember them in the past from COVID is the other time people have come across them. But when you go to altitude, your blood saturation drops. That means that your body's carrying less oxygen around the body for every heartbeat. Therefore, heart rate has to rise to maintain that oxygen delivery and that fuel delivery to the brain, to the cells and everything like that. And then obviously on the last 2 points, but obviously those blood changes with those very, very gradual climbs, and particularly those longer expeditions, so those multi-week expeditions, those changes in blood are something that's quite key. And when you go to altitude and when you put yourself in a hypoxic condition, you do begin to grow more red blood cells. It's a very, very famous method. Again, it's been used by athletes in the past, but it's really beneficial for us mountaineers because if you can grow more red blood cells, and they're the cells that carry oxygen around the body, you can deliver more oxygen to those working areas. And then obviously around those muscular adaptations as well. This is a slightly newer line of research that's been around in the last probably 10 to 15 years. But there's been some really interesting literature come out around causing changes in the muscle around mitochondria. If you ever remember back to the term mitochondria, or like the powerhouse of the cells, when you go to altitude, you can increase the density of them, increase the efficiency of them. And one of the other adaptations you get, which is quite nice, is an increase in capillarization. So what that means is basically you get more capillaries growing within the muscle, which again is really useful for that diffusion gradient. So if you've got more surface area, so more capillaries within the muscle, you can get more oxygen in and out, and more importantly as well, you can get fuel in and out and waste products in and out as well.
Awesome. Guys, that's just quite incredible overview of what's physiologically happening in your body, how you're reacting to this. Folks, if you've climbed with us before, especially if you're over 50, you've noticed that we do cardiac testing, and this is exactly why we do it. Things are happening in your body that you're not necessarily like attuned to or feeling, and so that's why we have you do that type of testing. It is also the reason we employ really slow and steady acclimatization schedules. If you've done Everest with us, if you've gone even just to Everest Base Camp, you're gonna rest a day and then hike a day and then trek, another day. There'll be just back and forth like that. And so we are really proud of the schedules that we keep to allow your body this time to make the changes, to adapt, to feel a little bit better in the moment than a little bit worse. Because one thing we're all trying to avoid are those, those dreaded headaches, sicknesses, things like that. So we are going to switch gears. Of course, we all have a sense that we need to acclimatize, but beyond just avoiding the headaches or altitude sickness, which we're going to talk about that, there are some other reasons that mountaineers, and Nick was just alluding about your muscles and the way they can react and interact and actually be improved at altitude over time. So why we need to acclimatize go just so much farther beyond just, like I said, avoiding those headaches. So Chad, this is where I'm going to tap into you. Tell us a little bit about how that proper acclimatization, climbing high, sleeping low, rest days, how all of that can impact us as mountaineers and as climbers.
So I think that Nick and Dr. Brent explained it really well, and I'll try to reiterate some of what they said and elaborate a little bit on that. But, basically mountaineering is a physically demanding activity. And so when you go to an altitude environment, you're going to lose some of the blood oxygen saturation that you would normally have at sea level, like that number, that SpO2, which indicates what your blood oxygen saturation is is going to decrease when you get to altitude. So the idea of acclimatizing gradually is to allow that number to increase while you're ascending gradually. And so you are becoming more capable of performing work in that altitude environment and developing, the capillarization that Nick talked about. That's the ability to get blood flow to the muscles so you can perform work. But I think for me, a couple of other things that come to mind, in addition to just the hematological changes that affect the physiology, are like, mountaineering is physically demanding. Mountaineering is a team endeavor. And you're also typically in austere environments. So if you're not properly acclimatized, if you run into an issue, those are resources and commitments of, say, a helicopter that needs to perform some kind of high mountain rescue, or someone else that needs to be mobilized to help get you down from a high mountain environment. So I think the importance of acclimatization for mountaineers is super important because of the type of environment you're in, the kind of work that you have to be doing, and the fact that it would be quite difficult in most cases to get someone down from a high altitude environment if they're not properly acclimatized.
We've been talking about kind of the science, the physiology. If you're in a lab, if you're sitting there with Nick, he's going to be watching your blood oxygen saturation, things like that. We're going to be now switching to actually what you are feeling on the mountain versus like these things that get tested when you're at home and whatnot. So we're going to be talking about what are you actually looking out for and feeling, what is normal, what is abnormal on the mountain, and how can you stay attuned to that. Nick, before I switch slides, I know you've had a lot of athletes on the mountain this year and a lot of really great success with acclimatization. Will you just give us a little sneak peek into some of the successes you've had from proper acclimatization just this year? I know you mentioned you had a big year, so I want to give you a moment to do that, and then we'll jump into everything that you guys are looking for when you're out there.
We've been very lucky this year. We've had a very, very successful year here at the Altitude Centre, both with climbers based in the UK, as well as we've been lucky enough to work with climbers all over the world. So I was having a look, knowing I was coming, I had a little bit of a look through the data this morning. So we've had just over 700 summits for under 6,000 metres. We've had about 100 summits between 6,000 and 7,000 meters. We had 29 8,000 meter summits this year alone, 25 of them being on Everest, which was really, really nice for us. It showed that kind of the hard work that people put in beforehand pays off, and it gives them the opportunity to have that once a lifetime trip. And I think the biggest feedback that we get from our clients, and the biggest thing that we get in terms of people coming back to us, is they just have fun. Like going to the mountaineering, the reason we all climb is we really, really enjoy it. Nobody would go anywhere in the world, and nobody would go and put themselves in any of these sort of environments if they didn't really enjoy the experience it gives them. And for a lot of people, whether it be Machu Picchu or Everest Base Camp, or your goal is to summit Everest, it really doesn't make a difference. Everybody just wants to enjoy their climb and make the most of it. And kind of we have a motto at the Altitude Centre that kind of summiting is goal one, but enjoying it is goal two. And we want everybody to kind of go through that whole experience and enjoy absolutely every minute of it. We don't want people to waking up with banging headaches or suffering maybe some of those horrible symptoms of altitude sickness, like vomiting or sleep disturbance or losing their appetite. It all comes down just to getting yourself ready and just making sure you can have as much fun as possible and just giving yourself the best chance of summiting, because the mountains sometimes don't want to be climbed. You can be the best athlete in the world and everything can be set for you, but sometimes they just don't want to be climbed. But as long as you do everything that's within reason for you and you turn up ready to go, just have an amazing time. And that's what acclimatization is all about, just giving yourself the best opportunity to have the best time.
Awesome. Nick, those athletes that you have up there, those mountain climbers, of course, they're training, they're doing pre-acclimatization, maybe with you guys, maybe not with you, maybe just going to high altitudes as well. When you go to high altitudes, as I just alluded to, you're going to feel things no matter what. That's just kind of how it rolls, the dice rolls. We're trying to avoid the vomiting or too much of a sleep disturbance, things like that. We've been talking a lot about like, oh, this is what your body's doing. You know, you're making more red blood cells, your heart rate is going up, your breathing rate is going up, things like that. But this impacts you all over the place. It's not just like, whoo, I'm breathing harder. Of course, you are breathing harder. That's fine. But there's a couple other things that are actually happening. Your body isn't necessarily like doing this, but it's kind of you're kind of combining your environment with your body. So before we dive into all the medical things that Dr. Brent is going to walk us through to make sure we can stay free and clear of altitude sickness and HAPE and HACE, I would like, Nick, I think you're going to talk us a little bit about just how these responses happen and other responses outside of just like, oh, I'm breathing hard, oh, my heart rate's up. What else can we expect to feel and try to mitigate when we're at altitude?
Again, it very much dictates the altitude you're going to. Because obviously the higher we go, the bigger the response on the body. It has that exponential effect. But the four big ones that people do feel is a higher heart rate, or higher resting heart rate and active heart rate that we spoke about, that increase in breathing frequency or respiratory depth. So the depth, the breaths, can feel deeper and feel longer. The third one is particularly around dehydration and fluid balance. That going to the toilet more. That increased urination, which again, as Dr. Brent alluded to, is linked to the kidneys and the excretion of urea, which is where urine gets its name from. But dehydration as well, the other thing I would think about for people, and those who've been climbing before will know what I mean, but mountain environments are very, very dry. The humidity in the mountains is normally quite suppressed and quite low, so you do lose quite a lot of a liquid through breathing. The final one is just around how hard everything feels. When you go mountaineering, everything just feels more difficult. And whether that is kind of within the body and kind of the body's processes slowing down, ranging from healing through to other factors, or kind of exercise itself, it feels harder. Or for those that know the term RPE, you'll just have to get used to the fact that even walking feels like running feels like jogging. And it will take you longer to recover from these activities. So something at sea level that might seem completely untoward, when you go and run up the stairs in Namche Bazaar, it might feel like quite a hard activity. And it's just understanding that is completely normal. And it all comes down to the lack of oxygen in the air and the impact that it's having, basically. So all of those are normal. The heart rate, the breathing, things feeling harder and going to the toilet more, they're all completely normal elements. And don't be worried. And if anything, particularly the toilet or the urination side of things, I'll keep it PC, but we are talking solely number ones here. Number twos are less ideal, solely talking number ones here. That's actually a really good sign that somebody's kind of going through that process quite nice. And if you're not going to the toilet large amounts, that might be a sign that your guide might have a chat with you that you're not actually drinking enough. So it might be something that they use just to keep an eye on you, just making sure that you are actually looking after yourself. Because at the end of the day, you can do everything right in preparation. But if you make silly mistakes on the mountain, like food or hydration or cold exposure, which I know Dr. Brenton's going to move on to, then things can unravel quite quickly.
Awesome. Nick hit quite a few important things there, folks. It's really good to be attuned of what is normal, what is like acceptable. Yeah, my heart rate's going to be higher. I'm going to feel more tired. I'm going to have a little harder time sleeping. It's going to be harder to stay warm. I might even pee more, and that's okay. It's great to communicate those things with your guides so they know, yep, this is working. We're doing it. Everything's looking good. But on the flip side, there are going to be things that Dr. Brent's going to dive into that are the things that you're going to want to maybe wave a little bit of a bigger flag and say, hey, this is happening and I'm not feeling so good. So understanding what's normal versus what's not normal is so important when you're at altitude. So you can communicate that with either your guide or your climbing partner so everyone can stay in the know. So Dr. Brenton's going to be taking over for a couple of slides here, but we're just going to start with this general slide on altitude sickness that gives us a little bit of the lay of the land of where we're going to go in these next little bit of conversation. Just give us a rundown of altitude sickness, the kind of different stages, and then Dr. Brent, we're going to break it down, as you know, AMS, HACE, and then HAPE, and then just generally other concerns after that. So I'll turn it over to you.
Thanks, Stephanie. AMS exists on a continuum, and like many things that you're used to and many illnesses and things you've had in the past, you can have a mild version that can become right the way through to severe. Mild symptoms of AMS are benign. They might mean that you just need to have a little bit more of a rest. You might need to work on those fluids and a few of the other things that Nick was talking about to ensure that we're acclimatizing well. It can then deteriorate to becoming moderate, and this is where your guide will need to take a step and will need to assess you, and then we'll need to make a decision about the appropriateness of continuing on your expedition or not. And when it is moderate, it can be inconvenient and unpleasant. We'll go through the symptoms that you would expect to be feeling in a tick, and then it can advance to becoming quite severe and can indeed become life-threatening. And at the life-threatening end of acute mountain sickness is what we call HACE, which is high-altitude cerebral edema, where your brain starts to swell. And this is an emergency, and this is where we need to take critical steps to ensure that you survive. Now, outside of AMS and separate to the AMS HACE continuum is HAPE. So high altitude pulmonary edema, where you suffer from swelling in your lungs or fluid in your lungs. And this can occur with or without symptoms of AMS. So there are a number of people that get a little bit confused about this. They'll go, yeah, I was traveling along really, really well. I didn't have any symptoms of AMS. I didn't have any headaches. I wasn't nauseous. I didn't have any of those problems. But then bang, I couldn't breathe. And it's like, well, yes, HAPE can occur outside of the AMS continuum, and that is actually quite common that it does. And so people can be tracking along quite well, and then all of a sudden get struck down with the symptoms of HAPE, and we'll go into those a little bit more. And again, it is an emergency, and we need to take steps urgently to ensure that you're managed appropriately if you do suffer from HAPE.
Yeah, Dr. Brent, I think that's so important. I mean, I've gone through my wilderness first responder multiple times, and I don't think I knew how clearly like HACE is connected with kind of those benign, mild continuum from AMS, and how HAPE is really separate from that and can just show up and be like, hey, I'm here. This is not so good. So I think that that's just really an important fact there, folks, that HAPE can really happen outside of the box and can surprise you a little bit more. And so communicating that, sharing, hey, I all of a sudden cannot breathe. I all of a sudden cannot do this. So let's go ahead and dive into it. We're going to start with acute mountain sickness, AMS. I think one of the most important things that's on this slide also, of course, the symptoms and the treatment. Dr. Brent's going to go over this, but he's also going to speak about the risk factors. What's going to put you at a greater propensity to get AMS? So turning it back over to you.
Thanks, Stephanie. It's important to look at what the risk factors are before we look further into AMS. And so what we're really concerned about is people who ascend too quickly. The Wilderness Medical Society and the Himalayan Rescue Association have come together with a couple of different approaches that you can use to utilize what we call as a safe ascent. And a safe ascent is basically ensuring that your sleeping altitude doesn't increase any more than 300 to 500 meters per night. And for every 1,000 meters of altitude climb, you need to have a rest day. And so if we think about this in terms of climbing up to Everest Base Camp, the common route is that people will fly into Lukla, which is at about 2,200 meters. They'll then spend the first day walking to a place called either Mondro or Phakning, and then they'll stay there, and that's at about an altitude, similar altitude to Lukla. And then from there, they'll go up to Namche Bazaar, which is at about 3,300 meters. And so they'll have their first rest day because they've gone up 1,000 meters. And so it's really important that you do take that rest day to allow your body to catch up. And then from there, they'll be up to Tengboche, and then on to, which is at about 3,800, and Ferroche, which is at 4,200. And people will have another rest day at Ferroche. And again, that's to allow the body to catch up. People who are tempted to acclimatise quicker than that and move through those places quicker are therefore putting themselves at risk of developing altitude illness. Now, these safe ascent profiles they're not infallible. They're protective from what we know from the data is that they're protective for about 90% of people. And so if you're in a group of 10 people, you'd expect that one is still going to develop altitude illness despite following the safe ascent profile. Aside from the safe ascent profile, we know that if you're suffering from an intercurrent illness, and by intercurrent, I mean some other medical problem going on, that does increase your risk of developing altitude illness as well. If you've picked up a bit of a cold while you're in Kathmandu or at the trailhead before you head off the town that you're heading through, if you develop traveler's diarrhea, which is super common in some of these developing countries that a lot of our mountains are located, or if you allow yourself to become dehydrated, or indeed any other medical problem, it does put you at risk of developing altitude illness. So it's important that we try and take steps to ensure that we're as healthy and happy as possible before we head out into the mountains.
Will you talk through some of the treatments and what you do if you start to feel these symptoms? We're pretty all familiar with kind of what you're going to feel, but will you walk us through some of those treatments and what to do once you're feeling a little bit sick?
Certainly. So the common symptoms that people feel with altitude illness is headache, and they can also feel a little bit dizzy. Having a lower appetite is common, but having a very poor appetite is uncommon. So you start to drop your appetite and get some nausea and vomiting, and then you can also feel fatigued and have some sleep disturbances. All of these things are relatively common at altitude, but it's important that you do take note and you discuss these things with your guide or your medical professional who may be on the trek with you as you go along, so we can assess what's normal and what's abnormal. If you do develop develop altitude illness and it's at the milder end, which we're talking about on the continuum, the first steps is to just rest. Provided that the symptoms are not pervasive, we can just have added in a rest day to your program and then see how you're feeling the following morning. And if after a rest day you're feeling better, you can continue on your trek or on your climb. It's important to take simple analgesia, and it's also important to know, and some people are scared about this, that it might mask the symptoms. We know that Panadol or acetaminophen, for those of us in the US, and ibuprofen and other anti-inflammatories, they don't mask the symptoms of altitude illness, but they'll help you to cope. They'll help you to feel better. They'll manage your headache, and by doing that, it enables you to acclimatise and feel better and to continue on your trek. Antiemetics such medications as metoclopramide and ondansetron to help with any feelings of nausea or vomiting are helpful. And then, of course, we go into the medications that can aid your acclimatization. So acetazolamide, or commonly known as Dimox, can aid your acclimatization. We can talk about that later. But if you do develop altitude illness, we know that taking 250 milligrams twice a day, so once in the morning and then once again in the afternoon at about 4 o'clock, will help your acclimatization. It's important to review how you're feeling in the morning, and if you're feeling worse or your symptoms are not improving, then descending, and this is to enter into an environment with more oxygen, will help to manage AMS.
Dr. Brent, thank you for that. We're going to keep moving kind of on that contingency from acute mountain sickness all the way. Now we're going to move into HACE, since those two are a little bit more closely related. So Dr. Brent, HACE is next up. This really has to do with what's happening up in your brain and your cranial space up there. You're going to go ahead and tell us a little bit about what to look out for, signs and symptoms, what might be happening. Also, what not like, of course, there's things happening in your body, but what your partners, your guides, your climbing buddies can look out for while you're maybe experiencing something like that. I think that's one of the most important things when you're out there, is to keep your eye on each other and to recognize it also in each other. So I'm turning this back over to you to talk about HACE just a little bit.
HACE, it's like being drunk but without having had any of the alcohol. That's an easy way to remember it for people. So people can suffer from a severe headache. They can be vomiting, they can be exceedingly weak, they'll have difficulty sleeping, they'll be dizzy. And when we're looking at someone, so that's the symptoms that they might complain about. When you're in a group with other people, you can watch them and you might see they're walking unsteadily, that they've got a clumsy walk, they're falling over, they don't have their usual gait. So the way that they step is changed. The climber or trekker may appear confused, they may be disorientated, they may be suffering from hallucinations, and we see this commonly. And then they may be suffering from reduced consciousness, and that's a bad sign. For instance, I had a client who was from Brazil. Her first language was Portuguese, but she spoke fluent English as well. As she climbed higher, she lost the capacity to speak her first language, so she was no longer able to speak Portuguese. And she didn't notice this, but her husband, who could not speak English, who she was trekking with, did notice this. And so that was a red flag for them. And so they sought the help of their guide, and then their guide brought them down to our aid post where we were able to manage this patient for her HACE. And the important management and the most important thing that we can do is to descend. Any medical intervention that we do have a bit of an armamentarium of things that we can use to treat people with high altitude cerebral edema, but the critical thing is to descend, and to descend as quickly as possible. So we want people to descend with a friend or a guide or whoever they're with. They need to seek medical attention. The things that we do will be provide oxygen. We can treat them with a few different medications, and then we can replicate descent by using a thing called a Gamov bag, which is a pressurized chamber, essentially, that we can put the patient into and pump up, and then that replicates further descent. But if you don't have access to these things, the critical thing is descent.
Once we're getting in, kind of away from the AMS and the headaches into HACE and HAPE, these are serious. This is without a doubt 100%. You need to be taking every precaution, every move, getting them down and seeking that additional medical attention. It's not just pop an ibuprofen, drink some water, I'll be okay. Really take these signs and symptoms seriously. You're also going to see descend on our next slide as well. We have HAPE here, and we mentioned this earlier. I'll mention it again. This may or may not have AMS symptoms or HACE symptoms as well. It could happen outside of the box of that. So I'll turn it back over to you.
Everyone is short of breath when you're climbing at altitude. But what's the difference between HAPE and just being regular short of breath? So what you see is you'll be with a group of people, everyone will be short of breath, they'll all be working hard, especially the further up the mountain that you get. But for someone with HAPE, they're the ones that can't catch their breath. So if you take a rest break for 5 minutes, the rest of the group, their heart rate will have dropped back down to baseline, their respiratory rate will have dropped back down to baseline, but the person with HAPE will still be working hard. They'll still be breathing hard. They may have a cough and they may still have a rapid heart rate. The other thing that we can commonly see is, you're on your acclimatization, you're still coming in, you get to the tea house in the early afternoon, you go back to your room for a rest. And then when you go down to go and have dinner later in the afternoon and the evening, you're bending over to tie your shoelaces up. You're walking from your room to the dining room and you're short of breath just on that very short walk. And you may develop a cough that may have frothy sputum. That's the other common picture that we do see. So someone with HAPE will have extreme shortness of breath. They'll have a cough. There may or may not be a blood-tinged sputum that they're coughing up. And when we listen as doctors to their chest, they've got this particular noise that we can hear with a stethoscope that is pathognomic or particular to HAPE. And it is a real clear picture that this person needs to descend. Again, the treatment of choice is descend, descend, descend. But the difference between HACE and HAPE is that with HAPE, they really need assistance because you don't want to be putting any extra exertion or any extra pressure on those lungs. So this is where we utilize any available means to descend. And so that might be calling in a helicopter if it's during the day and the weather is fine, or it might be utilizing some quadruped friends, so a horse or a yak or a jockey or whatever you've got available, or maybe potentially even a team of porters to get you down. We want to keep you warm. We're going to treat you with oxygen. Again, we can use that Gamov bag. And again, there are some medications that we can use to assist with treatment of HAPE.
Awesome. That kind of rounds out our altitude sicknesses, but there are other things that can be happening to your body, other high altitude concerns that kind of are medically related that I'm going to let Dr. Brent talk about. And then a number of you asked some specific questions that relate to kind of medical high altitude sicknesses, medicines, things like that. And then I'm going to ask those as well, Dr. Brenton, while we're on the slide. So beyond the impacts of high altitude on our body, when we're at altitude, of course, there are other things we should be watching out for. Just, simply a sunburn is one of them. We are usually all pretty good at putting sunscreen on, but that can really mess up your trip and not feel so great if you get out there and get a really bad sunburn. So walk us through some of the other medical concerns that people should be considering when they're out in the mountains at altitude and even in the lower mountains as well.
There are a range of different problems that you can find at altitude and in the snow. And so this is just a very brief, there's lots of things listed here, but a lot of these are all about prevention and you can prevent these from occurring by taking some simple steps. So snow blindness, making sure you're wearing appropriately rated glacial glasses or goggles will prevent that. And we commonly see this here, even in Australia, in October, November, where people are into the backcountry in spring and they don't have the right glasses, but they're at the trailhead anyway, so they thought they'd just go out and then they come in the next day with snow blindness. Hypothermia due to the extreme cold, and along with that, we do see frostbite as well. And again, there are some simple techniques that we can use. And I mean, this could be an entire Zoom meeting or webinar in itself on frostbite and hypothermia. Travelers' diarrhea, as I mentioned, many of these places that we go to in developing world countries, so we are at an increased risk, and staying on top of that and managing that with appropriate medication and fluids is super important. In the Khumbu, so on the way up to Everest, we do talk about what's called Khumbu cough. It's a form of bronchitis. It's basically because of the dry air, as well as a few other irritants such as yak dung fires and the dust that we see on the trail, that you do develop, and I've got a bit of a hoarse voice at the moment, you do develop a hoarse voice, and by preventing it by wearing a buff up around your mouth to help warm the air as we breathe it in, that can be helpful. Briefly, periodic breathing and various physiological reasons for this, but we know that at night you don't tend to sleep as well, and you can develop pauses in your breathing, and then you'll have a big gasp, and quite often it will wake you up, or it might wake up your roommate as they think you may have stopped breathing, and then they might throw a boot at you or something to stimulate your breathing. That's a common thing that we see as well. You can get peripheral swelling, so people complain of facial swelling, finger swelling. We even saw this in one of our clients at 2,000 meters on the weekend. She had baggy eyes in the morning when she got up, and that was just some swelling that she'd developed due to the altitude. Carbon monoxide poisoning, if you're cooking in your tent, is super common, and we have seen deaths on Everest from people from carbon monoxide poisoning, and it's a common cause of deaths in the mountains, so it's important that you vent your tents if you are cooking. HAEF is a bit of a funny one. We do see this quite often, and it's more of a problem for your tent mate, and it's high altitude flatulence emissions. We're all a little bit gassier at altitude, so we do tend to stink out our tent mates a little bit. And then subconjunctival hemorrhage, and I saw this in another patient earlier this week in my own rooms, where you get a little bit of bleeding in your eye. It's super common. It can occur at altitude, and it's usually nothing to worry about, but it's always worth asking about.
Okay, so Dr. Brenton, I have a couple questions coming in from folks. They've had a heart attack and they're looking at Everest Base Camp Trek. What would you recommend? I know you can't necessarily give specific advice, but what course would you recommend that he takes to ensure that this is something he can take on potentially as safely as possible? So what would you recommend there?
There's so many patient-specific factors to answer this question. At the outset, yes, absolutely 100%. He could make it to Everest Base Camp at some point, but it depends on the amount of cardiac damage. It depends on what their residual cardiac capacity is. And so pursuing some testing with someone like Nick so that you can get a good picture of what your capacity is and then give you a good indication of whether indeed it would be appropriate and what your chances are of success. So I'm not a doctor that rules things out based on your past medical history, but we probably do need to do a little bit of work to optimize you to ensure that you can get there safely. And as we talked earlier, happily as well, because that's why we go to the mountains, to be happy.
That's awesome. And then another one that's kind of related with different medical conditions that people might have. They have sleep apnea, and I'm curious if there's any suggestions, tricks, tips, what to also seek for testing to help out with sleep apnea in the big mountains.
And again, lots of patient-specific factors with the causes of sleep apnea and whether indeed some patients do benefit from particular surgical procedures to optimize them for their CPAP. And so whether that would be appropriate for this particular person, I'm not sure. But again, having a discussion with a respiratory physiologist or respiratory physician prior to travel would be appropriate, and to see what optimizations the patient can have. For some people, it'll be weight loss. Weight loss can do amazing things for obstructive sleep apnea. That can be a huge game changer. So it can be optimization, but yeah, again, a lot of patient specific factors on that front.
Awesome. So we're going to keep talking about Diamox a little bit as one of the tools to use while you're in the mountains. But the question is nicely posed, and I think it's good right here. When people take Diamox, sometimes people take it, oh, hey, I'm not feeling good now. Some people take it before their trek. Is there a general guideline, or is there a way you like to talk about how to use Diamox, best practices, if somebody is using it?
Yeah, thanks, Fred. That's a fantastic question. So yes, Diamox can be used as a prophylactic to help prevent altitude. So thank you for bringing that up. So current guidelines is that you can take 125 milligrams, so that's half a tablet, twice a day. And you basically start the night before you travel to altitude. So if you're the night that you're in Kathmandu, so Kathmandu itself is at 1,400 meters, so it's a reasonable altitude. The last night before you jump on that plane to Lukla, or that helicopter to Lukla, you take your first half a tablet, and then you continue until you reach your highest altitude. If you were just doing an EBC trek, for instance, you would continue to take half a tablet right the way up to Gorak Shep, which is where most people will sleep for the last night, or indeed Everest Base Camp, if you're lucky enough to sleep in Everest Base Camp. You keep taking half a tablet morning and in the afternoon, and then the day that you start to come back down, you can stop taking it. However, if you do develop symptoms of AMS despite taking Diamox, you would continue to take the Diamox until you were at the altitude that you developed the symptoms of mild AMS. So if you develop the Ferrochet, you would keep taking it until you're at Ferrochet. Now, the thing with taking Diamox is not without its side effects. So some people can get this, what we call the zings, or some tinglingness. You get some tingling in your fingers or around your mouth. It usually lasts for about 10, 15 minutes, comes on about half an hour after you have the medication. Most people tolerate that pretty easily, but some people do find it quite concerning. And for those people taking the evening dose before going to bed so that they're sleeping through the zings can be helpful. Diamox is a mild diuretic as well. And so that's why we suggest taking it 4 o'clock in the afternoon rather than before bed, so that you can do all your peeing before you go to bed. And then you can get hopefully a good night's sleep. It does also alter the taste of carbonated beverages. So if you enjoy a Coca-Cola, which a lot of people do on the trail, it will make it taste flat and metallic, and that's just the Dimox. So if you're taking Dimox, don't waste your money on carbonated beverages. We shouldn't be drinking alcohol anyway as we acclimatise, but yes, it has the same effect on beer.
Awesome.
So it will feel flat and metallic.
Okay. And then I had a question that was specifically about having one lung. And I suspect the answer is probably pretty similar to what you said about somebody who's had a heart attack. This person has one lung, it's enlarged, it functions at 75%. Can they even consider Everest Base Camp trek?
Yeah, absolutely. As I alluded to earlier, I'm a doctor that usually almost never says no to people, but it is important that you, rather than shooting straight for the stars and go, yeah, I'm going to go up to Everest Base Camp, you might want to gradually expose yourself and see how you go. So it's a big investment flying to another country and doing that sort of thing, perhaps potentially looking at some treks closer to home that might get you initially to 2.5, then 3.5, then 4,000 meters, and just seeing how you go and seeing how your body acclimatizes to that will then give you a good indication of how you might go trying to get up to Everest Base Camp, which is at 5,340 meters. There or thereabouts. It slips down the glacier each year a little bit.
Yeah. Last question. If somebody's a smoker, how does this impact how they're acclimatizing? Are we like totally off for Everest Base Camp trek, or is this something they can consider if that is something they partake in?
Yeah, again, there's so many patient-specific factors with that. And as you will all know, you might all have this great aunt, Beth, who made it to 95 and she was a pack-a-day smoker. Or, you might have had a cousin who died in his 40s from lung-related issues from smoking. So each patient responds differently to smoking. There are so many different factors and also, your baseline fitness and things. So yeah, again, wouldn't rule it out. I have treated Sherpas who were smoking up on Camp 3 and they took their gloves off and they were smoking and then they got frostbite from smoking at that altitude. So yeah, we do see people smoke right the way up to the summit of Everest. Again, there are so many different factors that it just being a simple 10 a day, half a pack a day smoker, it doesn't rule you out from going to base camp.
Yeah, awesome. Okay, and then I wanted to ask you, Dr. Brenton, Nick, I'm going to have you tell a story about your one lung climber in just a second. But Dr. Brenton, we mentioned obviously the Altitude Center is in London to get additional testing. There's places in the States here where you can do it. But is there anything in Australia where if you want to get additional testing for high altitude, how your body is reacting to a hypoxic state? Is there anywhere like that in Australia?
Yeah, look, there's probably no specific clinic set up in Australia where that would happen. However, there are a number of doctors with experience at altitude who would be able to provide an assessment and give you a good indication of what's available. And I do see patients privately in my GP rooms, either here in Jindabyne or via telehealth, and provide that sort of advice to patients.
Awesome. Dr. Brent, that's really awesome to know. Cool. This question has been rolling around quite a bit in the chat box. I'm just going to say to the gentlemen that are here, our co-hosts today, a couple of the questions that have been asked that relate to this. I heard adaptation to altitude is genetic. Can you predict which people will perform or adapt better at altitude? If you have like anemia, if you're vegetarian, are you like, oh, this is going to be harder for me? So this is the kind of the main question at hand. Does everyone respond the same? And are you always going to respond the same? I wanted Nick to jump in. He's also worked with a client with one lung. I skipped right over that, but you can chime in a little bit there. Nick, I'm going to have you chime in first. What are your thoughts on this question? Is everyone going to respond the same way? Are you always going to respond the same way?
You're kind of giving it away with a big 2-word answer in the middle of the screen. Everybody responds differently when they go to altitude. And I know, Chad, this really is your area in terms of kind of risk factors and things like that. But there is, without going to altitude or going to a simulated environment, there are actually very, very few markers that can give us an indication of risk. One of the biggest misconceptions people have is that they're super, super fit. They'll be absolutely fine. Sadly, it doesn't quite work that way. And I think one of the other things I would say, particularly for people who are doing multiple trips and climbing higher, is just because you were fine on one mountain, it doesn't necessarily mean you're going to be absolutely fine on the next mountain, because situations change, body changes, and your situation and the decisions you make on the mountain change as well. So I think the biggest advice I'd say to people is just don't be blasé about it. Like, the risk of haste and the risk of hate, yes, they're very scary, and yes, they are there. Thankfully, because of the protocols we've got in place, they are not super common. Like, it's not going to be 1 in every 2 people experience those sort of symptoms. But just be aware that they do exist. And by going to a high altitude environment, you do put yourself in a situation where they can develop, but just be responsible for the way you act and be responsible in your preparation. And that's kind of always my answer when it comes to this, if that makes sense.
Yeah. Okay. Thank you. And you alluded to it, Chad. This is really your bread and butter. When we spoke about this earlier, you really did speak at length about how it's just so unpredictable. You've even studied this, I think, when you were doing your master's degree or something like that. So I'm going to let you go ahead and jump in. Tell us a little bit about what you've learned and trends you have and haven't seen.
Thanks, Stephanie. Research trip I did to Nepal was specifically part of a couple decades long research study that Dr. Broussard was doing from Syracuse. And he spent most of his career as a PhD researcher trying to figure out what the markers are to determine who might or might not develop acute mountain sickness symptoms when traveling to altitude. What he explained, what my experience has shown me, is that one of the very few markers that exist, because there really aren't any strong indicators or clues as to who might or might not, like Nick said, just because you're a fit athlete doesn't mean that you'll be fine at altitude. And because you're maybe not the most fit person and you might be even a few pounds overweight or whatever, doesn't mean that you will suffer at altitude. But generally, the one indicator that was brought up is that young males tend to try to ascend a bit faster than other people, and that is something that does contribute to a higher incidence of acute mountain sickness symptoms. But other than that, there really are no key indicators for what demographic would be suffering.
Yeah. It's kind of just really, it could happen anytime. If you were great on Everest Base Camp, but you go to Kilimanjaro, it's not a surefire that you're going to feel great on Kilimanjaro. Really being mindful. And I think you mentioned the only trend you noticed was the rapid ascent is one way that you're probably going to feel not great on the mountain and struggle with your acclimatization a little bit. So I think that's really important, just to be really clear. There is no way to know how your body's necessarily going to react. Dr. Brent, do you want to add anything else here about how folks acclimatize, don't acclimatize, what you've noticed?
Yeah, certainly. It's also worth mentioning that the Earth is not a perfect sphere. And so the further you get away from the equator, also mountains feel different. So Aconcagua, which is further away from the equator than, say, than the 6,000 meters in the meter peaks in Nepal or Pakistan or India, it feels higher because it is further away from the equator. So Vinson down in Antarctica, which is the highest peak down there, feels higher than what it actually is because of the shape of the Earth, essentially.
Yeah, so folks, when you're like Vinson down there, it's just going to feel different because the barometric pressure is different, the shape is different of the Earth, and it all is going to interact different in your body. So physically, where you are in the globe matters, what you're eating, how much water, the temperature outside, all of that does matter, and is why it's not something that can be predicted time after time. One question that I've actually seen come up twice, I think, Chad, this one's a good one for you. I remember I was talking to one of our 7 summit finishers, Julie, a little while back, and she went up and she was trying to summit Everest, but she got sick. She got like bronchitis, and then she got the Kubu cough. She came down, but she was cleared by the doctor and was like, I didn't want to lose my acclimatization. I was still there, so I wanted to go back up. So how long does acclimatization last? And again, it might not be a hard, fast rule, but there was a couple questions. How long does that last? Once you're acclimatized to a certain level, how long do you kind of have those benefits?
We typically explain to clients that after about 5 days, you start to lose some of the adaptation. And that time period of when you lose the entirety of the adaptations of being acclimatized to a specific altitude depends on how long you spent in the environment preceding that 5-day period or preceding when you departed from that specific altitude. Does that make sense?
Yeah, it does make sense.
Yeah. So 5 days, after 5 days of being like for us, either outside of an altitude tent for pre-acclimatizing purposes or away from the altitude environment is when you start to lose some of the adaptation. And then the speed at which you lose it depends on how long you've spent in the environment.
Perfect. Awesome. You do have a little bit of a window. There are a lot of environmental factors going on and personal factors, but there is a window that you can look at and kind of hope for when you're in there. We're going to switch gears kind of away from the sicknesses, the impacts on the body, and now talk about actual strategies before your expedition and then also strategies during your expedition. So there are a number of questions in here, maybe about like breathing techniques, how to train, things like that. So we'll be jumping in and answering all of those now. We're thinking about preparing at home and using our training and things like that. So Nick, your bread and butter physiology, how can somebody get ready at home for a high altitude trip?
Well, I think the first thing to say there is the best way to get ready for the mountains is to be in the mountains. Like, there's nobody ever disputes that. And I know, Dr. Brenton, you alluded to it earlier in terms of like descend. The best thing to do is just spend as long as you can in the mountains. The more time you spend in that environment, the better you're going to deal with it. However, if you're like me and you have a full-time job, sometimes taking more time off work or trying to fit everything into a very busy life is difficult, and your 21-day Everest Base Camp trip might not have space to turn into 23 or 24 days. So it's a case of what can you do beforehand? And as Chad said, there are no genetic markers when it comes to altitude, or there's very few anyway. The only way to find out how you deal with altitude is to go to altitude. And that can either be done on location, so Kilimanjaro, Everest Base Camp, anywhere like that, or through testing beforehand. So we always recommend, and it's the same protocol that we follow with our athletes, no matter what you're doing, is we always say just do some form of testing first and find out how your body copes. As Dr. Brenton said, 90% of people will be covered by that steady acclimation process that you follow. And Nepal's a great example where it is done really well. There are examples where it is a little bit more difficult, like Kilimanjaro, for example. You climb 5,000 meters in 5 days. Well, that quite clearly breaks that do 1,000 meters, have a day off rule. So some mountains are a little bit different and pose a little bit of a different challenge. But we always say start with some testing and see how your body responds and how your body copes. But from there are kind of multiple pre-acclimation strategies you can follow. They can be done at specialist sites. So there's a couple around the world. There's not a huge number of them, but there are a couple, mainly based North America and Europe. I'll be honest, I'm not aware of any full-time sites. I know we've got a couple of people down in Oceania. There's a couple of sites where you can get to about 2,500 to 3,000 meters down in Australia that are used for fitness, but nowhere where you can go down really much higher than that. Or you can look at kind of at-home units, which is where I partner with Chad. And basically, instead of you going to the altitude comes to you. So if any of you into your sports, hopefully you'll recognise the face on the right. It's Kilian Jornet. He's quite good at running. That's an understatement. He's a very good ultra runner. But Kilian's a great example of kind of bringing the mountains to his house. So that picture there is a sleep system. So that tent goes over the bed. A hypoxic generator would then fill that tent full of hypoxic air at a controlled altitude that you could set yourself. And then you can basically begin your acclimatization strategy or your acclimatization process at home. So, for example, instead of acclimatizing over your 10 days up to Everest Base Camp, you may be able to extend that window to the 10 days before you left home, plus the 10 days on the mountain to extend that window. But again, what's really important is you do follow the processes and the structures that are being put in place around safe ascent. So even with these tents, we still follow that 300 to 500 meters of ascent. When you reach that first 1,000 meters gained, you have that night there. The process and the protocols are absolutely identical. It is just a case of extending that window and doing it at home rather than actually undergoing it whilst on the mountain or as well as on the mountain. So that's the most famous case with the sleep systems. There is some really interesting literature come out in the last 4 or 5 years around intermittent exposure as well. And let's be honest, putting the tent over the bed is invasive, to say the least. I'm not going to complain. We've got a heat wave here in the UK, so it was 30 degrees today. I've seen a few people from where they are, and you might think we're a bit pathetic, but 30 degrees in London's hot. So putting a tent over the bed might not be the nicest thing to do. So there are other processes you can follow in terms of IHE, so intermittent hypoxic exposure, or IHT, so training at altitude, particularly looking at those muscular adaptations we spoke about earlier. But pre-acclimation is all about extending the acclimatization time you have to before you leave on the mountain, rather than just on the mountain itself.
Wonderful. So, and I just want to make sure some of the words on here, that hypoxic training, hypoxica, remember folks, is really just an oxygen deficiency. So you can mimic this in many ways, simply going to the mountains, going to 10,000 feet, 3,000 meters, you're going to feel it up there. So get into the mountains, get up there. Don't skip on your fitness training. And then you can also, like Nick was just saying, bring the mountains to you. We're going to have Chad tell us a little bit about specifically the Hypoxico training system. On the next slide, we do employ this in some of our speed ascents at CTSS. But Chad, I'm going to turn this over to you, if that's okay, and have you tell us a little bit about the pre-acclimatization using Hypoxico 10. So I'll let you jump in there.
Two things come to mind when you ask how hypoxico systems play a role in pre-acclimatization. I think the first is it can really improve your confidence and your performance, those things going hand in hand. So back to the thought of, being at altitude, having your blood oxygen saturations lowered, which is sort of directly proportional to your performance being reduced because your ability to carry oxygen to the cells and to the muscles is reduced. By pre-acclimatizing in a hypoxico tent, so this would be using the sleep high, train low methodology, you would start raising those blood oxygen saturations while also gradually increasing the simulated altitude that you're sleeping at. This methodology has been around for more than 25 years. And what's happening is you're seeing your performance improve at sea level. You're also gradually sleeping higher and higher in this simulated altitude environment. So you're gaining some confidence in your ability to exist in that high altitude environment. The second thing is you could conceivably reduce the amount of time that you spend on the mountain or in the high altitude environment. We've seen different people, different climbing organizations do speed ascents, and this is something that has been done successfully. We can talk about that a little more later. Again, the two things, sort of performance, confidence, and then reducing the time in the true altitude environment, if that's something that sort of a criteria that you specifically train to with the assistance of guides and professionals.
Wonderful, Chad. Thank you for that. These are all things before your trip. Even if you're not using a Hypoxico tent, it is incredibly important to still mimic those conditions by going up to altitude as high as you can get and really honing in on your fitness and making sure you are feeling good for when that time comes in the mountains. I'm going to switch to Dr. Brent real quick. Let's talk about on expedition. While you're putting on your guide hat here, Dr. Brent, while you're on expedition, what are things that are being employed by the guide company like CTSS or about, just within a small group of climbers and folks together? What kind of strategies can you be employing, using, or thinking about while you're out there to help with your acclimatization?
Yes, certainly. So there are a few steps that we can take, and the Nepalis will say Bastari, Bastari. The Tanzanians on Kili will say Poli, Poli, which means go slowly, slowly. So what we do is we just take our time. When you've taken this bunch of time off to be in the mountains, we take our time to enjoy ourselves and we go slowly, slowly. And so we gradually gain altitude. And when we're walking along, we don't push ourselves as hard as we would. We're not trying to get any records, any world records here. So we're only trying to push our bodies just a little at a time. So we're not pushing ourselves into the red zone, because if you find that you'll put yourself into the red zone, it takes a lot more to recover. I've seen this before when I was working at Ferrochet, where I had some people who were long distance runners, and they'd get up to say Namche Bazaar, and they go, "Oh, I haven't done much work today. I'll just go for a quick run. I'll run up to Armadablan base camp and back." And then by the time they get to us at 4,500 meters, they're cooked, because they haven't given their bodies the time and the opportunity to acclimatize, because they've pushed themselves into the red zone too much. They've pushed themselves as hard as they would when they're at home, which has taken a deleterious effect on them. So the importance of rest days, the importance of rest during the day is super important to enable you to meet your goals. So one of the things that we can do is also to climb high and sleep low. So you might find that on your rest day at a place like Namche, you'll climb up to a little peak nearby, or up to one of the villages. You might go into a village tour, or you might go to the Everest Hotel, which is a little bit higher up, and then pop back down for the night. So you can climb high and then sleep low. And this does aid the body to acclimatize. Making sure that you're getting adequate hydration and nutrition. We've heard stories about people who, yeah, I'm going to go in the mountains, I'm going to lose 5 pounds or 10 pounds, I'm going to lose some weight. This is not the time to be doing it. This is the time that you want to go, yeah, I'm going to eat that Mars bar. I'm going to eat that Snickers bar because I can do it. You know, I'm going to get those calories in. I'm going to make sure that my body has the energy that it needs, that it requires to acclimatize. And so this is something that CTSS does really well. We cook great food for our clients. The food that you eat out in the backcountry or out on expedition is fantastic. These are some of those little 1%ers that you can use to ensure that you're meeting your goals. This is not the place to be losing weight. This is the place where you want to make the most of your appetite and eat what you can. We talked about pharmacological interventions earlier with the Dimox, and just to clarify, it's 125 milligrams twice a day, which is half of a 250 milligram tablet.
Yeah, that's important to keep in mind. If someone's giving you or you're taking it, split it in half if that's what's happening. That helps to answer a couple questions that folks asked. There was conversation about how does nutrition play a part in this? Ed asked that. It is incredibly important to be getting your calories, getting your food. How much extra fluid should you be drinking? I don't know if you have a good, like, kind of rule of thumb there. Is it just curious about your thoughts on that, Dr. Brent?
Yeah, even last week in the mountains here, I was making sure I was drinking 1 liter of water before I left the breakfast tent, just because I know that when you're in a cold environment and when you're busy and your water bottle might not be quite in the right place, it can be hard to remember to drink. And so making sure you're getting that, at least getting a head start by taking 1 liter in the morning before you leave the tent or leave breakfast is a good way to get in front at the start of the day to make sure you're therefore not getting behind later on. There used to be hard guidelines like you need to drink 4 liters above this altitude, but we don't so much stipulate that anymore. It's just important to make sure that you're not falling behind on the fluids, that you are drinking regularly. You might not have the same stimulation to drink, so just have a think about it and do try and get some fluids in as often and as regularly as you can. We also know that, you know, some people talk about the color of their urine as to how well hydrated they are, but there is a lag time in that. So certainly if your peeing is really, really, really dark, then yes, clearly you are dehydrated, but we don't so much worry about the color of your urine anymore, because again, it's different for people. And so you can make a hard, fast rule, but then it doesn't apply to some people. So just make sure you're regularly drinking. If you find that at the end of the day, you look at your Nalgene and you've only drunk 500 mils since you left at breakfast, you have not drunk enough water. You need to be drinking more than that.
And then one more question about while on expedition, you know, you have like the rest step and things like that. Are there any techniques you can do to help aid yourself in breathing? How can you help that? Can you work with that at all to maybe make it a little less stressful in your body and maybe a little bit more advantageous?
I think the easiest way and the best way we describe to people is just try to stay relaxed. It's very, very easy when things change to get worked up and then to consciously think that, oh, this is different, this must mean something. The biggest thing I'd say, the biggest advice we give to clients is stay nice and relaxed and just try to find a natural breathing rhythm. For any of you, and you'll have gone through your training when you're doing those harder efforts, whether they be your spin classes or your PT classes, or maybe even go for those jogs when you're out and about if you're a runner, you do find you tend to find a rhythm. Just do your best to find that is probably the best way I can do it, best advice I can give. There are techniques you can use around taking some quite deep breaths to artificially bring SpO2 up and things like that. But again, all of those are quite short-term measures. You're not looking at kind of a long-term approach there. And not to steal a question off you, Stephanie, but that probably ties in quite nicely to kind of the question regarding like oxygen boost canisters. Those little canisters you can get like almost like mini scuba tanks. Again, they're all very, very short-term measures, and the impact that altitude has. Altitude sickness takes hours to develop. You don't suffer altitude sickness in 5 minutes. You don't go to Namche Bazaar and then suffer in 5 minutes. It's going to be 5, 10, 15 hours. So what we look at and how physiologists and doctors use data is you look at trends. You don't take a 1 minute sample, you look at trends. And it's a case of, okay, you can use this breathing technique to artificially boost it for 5 minutes. You can use this breathing product to boost it for 5 minutes. But what about for the other 4 hours 55 of that 5-hour block? That's where the SpO2 or the impact of altitude is going to then have its response. So I would say my opinion, and I'm more than happy if people want to argue it with me, but I probably wouldn't say they're worth the money, those little breathing canisters. If you get to the stage where you're needing oxygen, either you're on a very, very big mountain and the team are going to have provided them for you, or if you're looking at taking oxygen, you're probably in a position where you should be starting to descend. Like oxygen, if anything less than probably 7,000 meters, with maybe a few exceptions, oxygen is a tool for mitigation or a tool for managing altitude sickness. It is not something you should be depending on. It's not our go-to way to go, oh, it feels hard, I'll just grab an oxygen canister. It doesn't work like that. And it's not necessarily the right way to climb. If you're getting to those sort of heights and you need oxygen, then it's probably a sign that maybe your body's struggling ever so slightly.
Yeah, look, I mean, the breathing questions come up because due to the Wim Hof technique, really, Wim Hof talks about all his various breathing things and how they can help to acclimatize. And so, yeah, that's a super common question that you get from people who are Wim Hof devotees. I might add here that the only patients I've treated for frostbite in Australia are Wim Hof devotees doing some of their cold exposure stuff in our ski resorts here. I've never treated anyone else other than people doing Wim Hof courses. So there, it is not without certain risks, but the breathing technique, certainly rest step does help. And, you know, we've just come back from a mountaineering course here in Australia where we teach our clients how to do a rest step, and that helps with your breathing as well. So if you're unfamiliar with that, it is worthwhile seeking advice from a guide on how to do that. That can certainly help with your breathing as well. But certainly finding something that works for you and that is comfortable for you. Again, patient specific, client specific solutions.
Okay. That wraps pretty much our acclimatization strategies before and during your actual expedition. Everything we've talked about can be applied to any expedition, whether you're doing Kilimanjaro or you're spending 2 months getting to Everest. And something that we kind of teased a little bit earlier is some people are employing, especially some of these pre-strategies, like Chad was mentioning, the Hypoxico tents. Some of these folks are employing this into what are called speed ascents and using the Hypoxico system to really mimic what they're going to experience and get them prepared. Speed ascents are becoming wildly popular. We do offer some speed ascents here. The shorter itinerary is really nice if you're crunched for time. I know here in the US, our time off is few and far between. So we do get a lot of US climbers who are eyeing speed ascents. If you're in Europe, you have the luxury of having a little bit more time off. So we do offer these, and we do work hand in hand with Hypoxico and even the Altitude Center in London, because they work hand in hand to offer these types of programs and get you the equipment and get you ready. Nick, I know you've seen a lot of climbers be really successful in this, and I'm sure Chad, you also have seen a lot of climbers just via Hypoxico be very successful with their speed ascents. Do either of you want to jump in and just tell us a little bit about the successes and how you might employ a Hypoxico system ahead of like Kilimanjaro or a 30-day, 40-day Everest, things like that?
Yeah, one of the most profound anecdotal pieces of evidence that I'd love to share with the group about a speed ascent is a client we had that went from sea level to the summit of Everest and then back to sea level in less than 20 days. And it was spectacular, actually. Basically, using our Hypoxico tents, using intermittent hypoxic training, which is exercising at altitude, and then also incorporating intermittent hypoxic exposure, which is a short duration, severe hypoxic exposure. So, our systems are limited to achieving about a 9%, going down to about 9% oxygen percentage at maximum. This process of IHE would basically be 5 minutes of breathing hypoxic air at 9%, 5 minutes of breathing normoxic air, and basically doing that for an hour. This particular client was training for several months and was able to basically do a lightning ascent of Mount Everest without experiencing any severe acute mountain sickness symptoms, certainly not any HACE or HAPE complications. And that's a case study that we share with some clients, and really just a remarkable example of how our systems can be used to do a rapid ascent.
Very cool. Nick, I know you've also seen some success in rapid ascents.
Yeah, I think the key with these speed ascents and the idea behind them is you don't change the length of your trip. You just change where you're doing your pre-acclimatization. I think that's a really key idea. Like, you cannot just turn up and climb Everest in 30 days. That is not going to work. Like that's not physically how the body is made to work. And how these, particularly these big 7,000-8,000 meter flash ascents work is you basically like helicopter into base camp. That's kind of the logistics of them. So you basically helicopter into base camp. You miss the trek up to base camp, for example, then miss some of the time sitting at base camp. You'd helicopter in, and then you'd start your rotations and you'd follow your normal 8,000, 7,000 meter protocol. So the way these plans work and the way these speed ascents work is instead of that structured trek up and then the time at base camp, you do all of that that at home. So that's the logistics behind them. And yeah, we've seen some really, really interesting success. Where I partner with Chad is basically anywhere in the US, Chad's the man to go to. He'll provide the kit and things like that. And then I typically tend to provide the training. Anywhere outside of the US, I provide the kit and I provide the training. So that's kind of the logistics from that side of things. But yeah, we've had some really interesting success. Of our 25 Everest summits this year, 17 of them were flash. We've seen very, very similar times to Chad as well. I think the quickest we had, 2021, we had a Heathrow to Heathrow Everest summit in 14 days, which is incredibly fast. I know, Dr. Brenton, we've had this chat. It starts to border on the ethics of mountaineering ever so slightly when you're climbing that fast. But what they can be really, really useful for is shortening the itinerary. So if people are short for time off, really, really good ways to do it. Or if people are worried about the altitude or have pre-existing conditions that could put them more at risk of altitude sickness. So whether that be testing shows they might be one of the 10% on an Everest base camp trip who could be at risk, or other mountains at Kili where maybe the altitude's harder. We won't necessarily look to follow a full speed ascent protocol because they are aggressive, but you can look to basically use a very, very similar sort of program to mitigate and manage the risk, right? You're never going to be able to completely remove the risk of altitude. It's like that's not possible. But what you can do is manage and mitigate that risk so somebody can turn up the mountain either partly or nearly fully pre-acclimatized to a certain height, so then the body is in a better position where it can then adapt at its own rate, which may be slightly slower than others. So the risk of altitude sickness or the symptoms of AMS may be as suppressed as possible. So that's where we come into it, basically.
Yeah. So folks, just a quick recap. Everyone is doing some sort of pre-acclimatization for your expeditions, whether it's just your fitness training or going to the big mountains, climbing a 14er, a couple of them in Colorado. That's awesome. You could employ other tools and tactics, just like Hypoxico, if you want to go have that time on the mountain a little bit shorter. I love Nick's point that it doesn't change how long you need to acclimatize and what you have to go through. You just do some of this at home versus in the mountains. So I see questions of like, well, I won't be pre-acclimatizing, but what are you doing to pre-acclimatize? You are working on your fitness. You are probably going up higher to elevation, even 3,000, 4,000, 5,000 feet. Just visiting Colorado will get you at a level of experiencing that hypoxic state. So folks, everyone's pre-acclimatizing in some way. We can speed that up a little bit and do more at home, so you have less time on the mountain, or you can do it a slower way and really take your time, taking those rest days and walking up the Khumbu Valley nice and slowly, things like that. Folks, if you do want specific advice on, hey, I did Rainier, or hey, I did Denali and this happened, what should I do now? How can I make this better? I would highly recommend you actually set up a Calendly call with Caroline Pemberton, our co-owner. She is just an incredible human being and has a wealth of information. You can schedule a free call with her. And I think that's a really great way to have these specific questions answered, that this is what happened, what can I do, how can I change it, and get the advice truly from a mountaineering company that is experienced with kind of the slow traditional acclimatization, but also speed ascents as well, and has a great relationship and can be in touch with Chad, with Nick, with Dr. Brent to say, hey, here's what we would recommend to help you out. So if you're having those specific questions, really take advantage of this call. And then I also wanted to share, if you're like, hey, I'm ready to rock and roll, I got a trip to Kilimanjaro and I really want to get tested at the Altitude Center with Nick and see how I'm reacting to different altitudes and what I need to do to train and come up with a plan. Their contacts are right here. So Chad and Nick, they share and collaborate a lot together. And then if you want to get in touch with Dr. Brent, be sure just to contact us because we're more than happy to reach out to him. He's a busy man. He guides for us and he's a doctor. So reach out to us and then we can always tap in his knowledge, or also your primary care physician will be a great place to start if you have more medical related questions. Folks, that wraps it up for today. You all have a good evening, afternoon, or morning. Thank you again, and hopefully we'll see you for our next webinar. Bye, folks.